Post Crescent and USA Today Network Wisconsin, and we are back for another week of Newmakers Coronavirus Edition. Today, I want to take you back to late February when we saw the outbreak of COVID-19 beginning at the Life Care Center of KIRKLAND, a nursing home in the Seattle area. Since then, nursing homes and long-term care facilities have been hit really hard by the virus. It's estimated that more than 40,000 long-term care residents have died of COVID-19 across the U.S., which makes up actually about 40% of the nation's death toll. And in Wisconsin, 1 in 4 nursing homes have reported at least one case of COVID-19. So my guest today is Sondra Norder, President and CEO of St. Paul Elder Services in Kaukauna. Her facility has weathered a few cases of the virus, but more than that, I wanted to talk more broadly about, what navigating this pandemic has been like in a long-term care setting, because it's something that, they've experienced a lot during this pandemic. And so I just wanted to get your perspective on how it's been going. So first, Sondra, I'm wondering, if there's anything that you can compare this to that you've experienced in your facility. I know that smaller infections can go through nursing homes all the time, and that's why you have things like infection control procedures. But is this like anything you've experienced before, or is it pretty incomparable?
It's totally incomparable. I can certainly draw comparisons, between the influenza and norovirus in terms of some of the things that we do to prevent transmission with those types of viruses. We certainly track symptoms amongst our staff and our residents when it comes to all acute respiratory infections and gastrointestinal infections. We certainly tell our staff that if they're experiencing any symptoms of those illnesses, that they should not report to work. We certainly when we do have identified cases of like a norovirus or an influenza, we do quarantine certain areas in our facilities, discontinue group activities, and those types of things. But we have never needed to totally restrict visitation to our facility before. Every fall, the signs go up on our door saying, if you are feeling unwell, please don't visit at this time. But we have never had to say no visitors at all. That is the clearest distinction that I can draw between the coronavirus response and the responses that we have to the the kind of established viruses that we experience and that we have vaccines for. The simple fact that this is a novel virus with no vaccine is what has required us to take those dramatic steps with needing to require the source masking and the visitation restriction and physical distancing. Those are the most effective tools to prevent transmission of this virus that has no vaccine for it at this point. We have never had to screen employees when they come in the door for fever. We have never had to report viruses like this to federal authorities. We've always had to report certain communicable disease to local public health. But there's a number of distinctions between what's happening now and what we've experienced in the past.
Yeah. So, when this started happening, both overseas and then when it made its way here and started in Washington, what was your reaction and the reaction of your staff when you saw what was happening at the KIRKLAND facility? What was kind of going through your head at that time?
Well, first of all, we have a lot of skill in skilled nursing facility, including in infection control. We have an infection preventionist on staff, and we have that person subscribes to all types of email listservs and is part of a number of groups that work off of science. And we saw the science coming out of Wuhan. we saw the science that was coming out of the East and the West Coast as this virus made its way to the United States. And so we based our decision making on the science that was showing us that this thing was going to be in Wisconsin before we knew it. And that when it did, and when it made its way into nursing homes, it was going to be catastrophic. So we had, we're grateful in a way that we had the benefit of time on our side. We had about a 2-week lag between, when things really started picking up on the coast to when, this virus started showing up in Wisconsin. So we had some precious time in which we were able to, really firm up our processes and systematically implement some of the protocols that we needed to put in place.
Yeah, so if you want to talk a little bit about what those protocols were, so once you were seeing that and recognizing that, then what were the next steps? How did you prepare? What sorts of things had to change in that 2-week span, like you said, to get ready for the presence of the virus?
Yeah, first of all, we needed to educate our staff, our residents and their families about all that we knew about this virus. It's new, and so we were all learning together. But as a healthcare provider, we had the benefit of getting updates from the Department of Health Services with all the latest information, and so we really needed to communicate and over communicate all that we knew about this and what was going to need to happen in order to keep our residents and our staff safe. So that was the biggest thing, was getting a line of communication open and established and working right off the bat. The second thing that we needed to do was make sure that we had our emergency preparedness plan up to date. Making sure that we had our, staffing plan, reviewed and up to date to make sure that should we have a third of our staff go out with this illness, how are we going to care for our residents? Making sure that we had as much PPE as possible. We have always had an emergency stock of things like gloves and masks and gowns, but it quickly became pretty apparent that we were going to need more than we even had ever stocked in our emergency stock before. And then, we, like I said, we kind of systematically had to start implementing, some of the protocols that we knew were going to be necessary due to the fact that we don't have a preventative vaccine for this virus. So, we started working through screening visitors for illness, and we had to kind of make a distinction between, okay, if someone traveled to Florida versus someone traveling to China or Seattle or Minnesota, and a few days of doing that kind of screening really shed light on the fact that this was probably going to be a matter of needing to shut down to all visitors, because people travel. It's kind of it was kind of eye-opening to realize how much people travel, and we just knew that every time we let somebody in the door who had traveled anywhere and hadn't been masked or hadn't stayed physically distanced, like you can't do on a plane, that we were potentially inviting this virus through our door. So we made the decision, even before the federal government did, to restrict all visitors here, because we knew that was going to, limiting the number of bodies coming through our doors was going to be a key. The people are the carriers of this thing. There's no other way that this virus is getting through our doors. And so we knew that limiting the number of bodies coming through our doors was going to be essential. And, especially as we started to see this thing make an appearance in Wisconsin, and started to see how quickly the numbers were adding up, we made the decision to restrict all visitors. And we also made the decision to start universal source control masking. Early on, there was a lot of disagreement over do cloth masks really do anything? And we were, I think, the first healthcare provider in this area who put a call out on social media to our volunteers and particularly those who can sew, start making masks for us, because we knew that we did not have the supply of disposable masks to do what we needed to do, and that is to keep people's nose and mouth covered at all times while in our facility. And some people kind of question that, well, they're saying that cloth masks don't help anyways, but we knew that at a minimum, what a cloth mask does is it prevents you from touching your nose and your mouth, right? And we knew, we had looked up research studies that showed that, okay, yeah, cloth masks they're not PPE. They're not going to protect you from someone else who's sick, but they're going to prevent, us from sharing what we have, at least at a 75% efficacy rate versus a 89% efficacy rate of a disposable surgical mask. So again, we followed the science, and we made our decisions based on what the scientific studies were showing, and how we know that respiratory droplets work. I think that taking that decisive action early on is why we have weathered this as well as we have.
Yeah, absolutely. And so kind of going back to the visitor restrictions, I'm just wondering, without being able to have families visit, and I would assume that, group activities and, gatherings between the residents has also stopped. And I'm just curious, how, it's obviously necessary, but, how have you seen that affect your residents? Do you think it's affecting their mental health to not have that interaction?
100%, yes, it is impacting them. And, we unfortunately had to say to our residents and their families at the start of this, we need to be laser focused on infection control to preserve life here. And we know that that is going to come at a cost, and that there is going to be heartache. There is going to be negative psychosocial outcomes because of what we need to do. And we need to wrap our heads around that. Our primary focus is protecting the physical health of those we serve. We are going to do everything in our power to make sure that psychosocial health is addressed and maintained to the extent possible. But we were very realistic in saying that there is going to be heartache. And we're not going to try to tell you that there isn't going to be. And I think that level of honesty and transparency really went a long way. But yeah, we have not been able to have Mass. We're a Catholic facility, and so people have not been able to gather for Mass, which they were accustomed to doing on a daily basis. We haven't been able to gather for, bingo or dining, which is such a social experience and is such a special part of our residents' days. So, in all those instances, we have done as much as possible to keep people, engaging with others. We've done the doorway bingo in the hallways. We've done, mobile happy hour, going around and serving drinks on a cart, again, like in doorways, so people can at least kind of see each other from down the hall. We broadcast our daily Mass with just the priest and our sisters in the chapel. We broadcast that to all the TVs throughout our campus, so that people can still watch and take part in Mass. And we've completely put all other non-essential tasks on the back burner, so that our therapeutic recreation staff can completely focus on virtual visitation with families. So we were fortunate that we already had a number of devices like iPads and things like that we could provide for virtual visitation, but we also invested in some more, and we've had some donations of those devices so that we can have as many people visiting virtually with their families as possible. And that's helped. But I will say that even though people, definitely are missing their loved ones, we're seeing health impacts from, just the new normal here, which includes not being able to see smiling faces of staff. I mean, just the fact that we're all wearing masks and people can't see our smiling faces, that it does impact people. There is no doubt. But at the same time, we've heard from many residents that they feel safe here, that they know that we are, all the actions that we are taking are for their protection. And so, many of them understand that it is a trade-off. Certainly it doesn't minimize the heartache that they're experiencing, but they know that their lives are the ones that are at stake here. They watch the news. They know that older adults in long-term care facilities are dying at disproportionate rates from this virus, and they know that that we have needed to go what almost feels like overboard to make sure that this virus doesn't get in here and take their lives.
Yeah. And, so on the other side of that too, I'm curious what precautions that you've asked your staff to take during this time. Have you asked them to adapt and change their life outside of work, or do they want to do that voluntarily? How has this been affecting them to know that, they are the ones who are, they have to interact on the outside of the facility, and because that's just life, but, that they come there every day. How has that been impacting them?
Yeah, I mean, our staff are certainly, they're special people, and in many ways, but for the most part, they have, continued to embrace the safer at home guidelines, because they understand that the most likely way that we have a significant outbreak here with significant negative outcomes is that one of them carries this virus through the doors. And they certainly understand that contact tracing at this point is so good that we would be able to figure out who brought this virus through our doors and potentially where that person picked up the virus. So our staff certainly know that, they would be putting a whole lot of people at risk if they're going to a large gathering and not taking precautions at this point. So, yes, we have asked our staff to continue to wear masks when they're out in public, to make sure that they have hand sanitizer on them when they are out in public, to make sure that they stay physically distanced from people when they're out at the grocery store, especially people who are not masked. So we have provided cloth face masks to our staff because of the hundreds and hundreds of donations of cloth masks that came in when we asked for them. We had plenty to share. So we offered them out to our staff and their family members to be using at home. And indeed, we have asked our staff if they have a sick family member at home to isolate themselves from that family member and have that family member wear a mask also, which our staff have been complying with. We provided for them, we got a 55-gallon drum of hand sanitizer donated to us. And we have that available for people to fill up their little purse size hand sanitizers so that they always have hand sanitizer on them when they're out in the community. We've asked them to, hold off on, going out to dinner with friends and going to the salon for your hair services and having play dates for your children. Please hold off on that until we know more about, what the spread is like in the state as we start to open up. And for having had the safer at home order go away almost a month ago now, our communities are not fully open yet. The bank lobbies are still open, movie theaters aren't open, restaurant dining rooms, for the most part aren't open. So we have a long way to go, and our staff, they are being asked to sacrifice in ways that others aren't. But again, they, for the most part, they are dedicated to making sure that they are not the one who brings this virus through our doors. Obviously, it's gonna happen, and it has happened 3 times now. We've had 3 staff members who have tested positive for coronavirus, all 3 which were deemed community spread acquired, meaning that they hadn't had a known exposure to anybody else who was positive. They obviously picked it up in the community. There was no evidence that they picked the virus up in their work in our facilities. But fortunately, the protocols that we have in place prevented those people from transmitting their illness anywhere else to any other coworkers or residents. So we're grateful for that. But we know that our protocols aren't 100% foolproof, and so the idea is to keep our staff safe when they're out in the community, so that they're not bringing that virus through our doors. And in terms of as the summer has come along and people want to be traveling and going on vacation, we've also told them that if you travel somewhere where it's potentially a hot spot of community spread happening, if you go somewhere to a large gathering where you're unable to socially distance or you're unable to stay masked, we are going to ask you to quarantine for 14 days. And so we have had some people make that decision. We have a nurse who's getting married, and she wasn't willing to postpone her event, and she's not willing to wear masks or not hug people. And that's obviously understandable, but we've told her that because of the heightened risk of an event like that, she's going to have to be quarantined for 14 days before she can return to work. So, we do have those safety protocols in place, but our staff are definitely being asked to take precautions that the general public is not right now.
Yeah, and so just to go back, as you mentioned that 3 staff members did test positive. I'm curious, so if you would talk a little bit more about that, when did that happen? What happened? What steps did you take when that occurred? And, how did you have to document and then report that, those incidences?
Yeah, so our first case was back in towards the end of April, and it was an employee of our nursing home here in Kaukauna. And just for a little background, we do have 2 campuses, one here in Kaukauna and then one in Green Bay. And this employee lived in the Green Bay area, and this was at the time when the meatpacking plant in Green Bay, when that outbreak was kind of first being identified, and there was a lot of community spread happening in the Green Bay area. Fortunately, this staff member was training on a new unit, and so she did not have any direct resident contact. She was just following another employee around, kind of shadowing. And because everybody was masked and there was no contact of more than 15 minutes, which is what public health looks at in terms of the likelihood of transmission, that the close contact needs to be for more than 15 minutes. Public health determined that there was very little risk of that person having transmitted anything here. And like I said earlier, the public health also determined that employee acquired the infection via community spread. So, when that first case hit, we did have to quarantine our nursing home because, there is always the potential that someone starts developing symptoms, and there's a 14-day incubation period. So public health actually requires us to quarantine for 2 14-day incubation periods. That's the 14-day incubation period for the person who potentially transmits it, and 14 days for people who potentially acquire it. So we did quarantine several neighborhoods within our nursing home for 28 days, meaning our residents weren't able to leave those units. They were asked to stay in their rooms. No staff floated in between those neighborhoods and any other area on our campus. And then that employee obviously had to stay home and not return to work until they met the CDC criteria for returning to work. We also notified all of our staff, all of our residents, all of our residents' families within the day of getting those results. We notified everybody and kind of reviewed all of the protocols that we have in place for preventing transmission of infectious disease and the additional steps that we are taking in terms of quarantining and increased surveillance of symptoms for people who lived on those neighborhoods and things like that. This did happen before CMS came out and required the national reporting. So this was not reported to that national system until mid-May when that reporting system went live. So that was our first case.
Gotcha. And when, just out of curiosity, when was the most recent case?
The most recent case came up when we did what's called point prevalence baseline testing. So it was our first experience with testing all of our staff and all of our residents here at our Kaukauna campus. And so for that, we had the National Guard come out because we have 450 staff approximately. And, doing it for this first time, we kind of needed to see how this was going to work. And the National Guard had experience with, doing these large testing sites like that. So we had the National Guard come out and swab all of our staff. Those samples all went down to a lab in Madison called Exact Sciences. And one of those tests came back positive for one of our staff members. And it was a staff member of one of our assisted living facilities. And around the same time, we had a resident of one of our assisted living facilities test positive as well. It was interesting that during that all resident testing, that resident tested negative, but then developed atypical symptoms, which is kind of what we see more often in older adults. We don't see the is as much the shortness of breath and cough. We see atypical things like diarrhea and vomiting. And so this person developed some of those more like gastrointestinal type of symptoms. They went out and got tested and did test positive. And so that was our first and only resident that we've had who has tested positive. That resident has made a full recovery, but did recover in our COVID-19 isolation unit, which we have had ready for the last couple of months. It is a 10-bed unit that we chose that area because its air handling system is completely distinct from the rest of the campus because it was a new addition a number of years ago. And we have a negative pressure air handling capabilities in those 10 unit beds as well. We had ordered these particular air handling units and installed them in those rooms to create negative pressure. And so all of our staff who work in that unit are fit tested for N95 respirator masks. And they are all assigned to just that unit when if we ever have a patient in that unit recovering. But like I said, we're really happy that this resident made a full recovery and has now tested negative twice.
Yeah, that is really great to hear. I'm definitely glad to hear that, and that you haven't had to make too much use of that isolation facility. That's definitely a good thing.
Right. And,
so,
the better news is that, there was no additional spread beyond those two most recent cases. We have not had any other cases. We've tested a number of people because we test anybody who even has a headache or someone who has nausea, someone who has a temp of 99.7. We're going to test all of those symptoms. And so we've done a number of tests since those most recent cases, and all have come back negative. And then just over the last 2 days, we did our second round of all staff testing. So we're anxiously awaiting the results of those tests.
Yeah, definitely. So looking forward a little bit now, I'm just curious, what your biggest worries are for navigating the rest of this pandemic, as long as it might last, and no one's really sure. What's kind of weighing on your mind as far as how things are going forward?
Well, I think the biggest thing is that we do need to get back to some ability to allow visitors in the building. And so we're anxiously awaiting guidance from the Department of Health Services on being able to open up to potentially some outdoor visits, some limited indoor visits, limited in terms of time allowed and number of visitors allowed, and the places where people can be within our campus, because this is it's getting to a point of being inhumane. When we have when we have the ability to mitigate, really mitigate the risk of transmission, we need to be able to start balancing the psychosocial needs with the infection control needs of our residents, because as I mentioned earlier, it is taking a mental toll on people. And so that's number one. So we have been behind the scenes preparing for the second we get the green light to be able to start offering some at least limited visitation, that we are ready to go. And I have promised all of our residents' families that we will deploy all available resources to getting at least one or two family members per resident in here as soon as possible to make a visit. And so the reopening plan to get back to, as normal as possible, it is going to be a very lengthy process. There is no doubt. But what it's going to take for us to move through that 3-phase plan is that, number one, we need to have effective testing programs in place. The federal government came out and said that nursing home employees should be tested weekly, but provided no other guidance on how that will work, how it will be funded. And so we have all been, 15,000 nursing homes nationwide have been, anxiously waiting from our states. Do you have additional guidance on how this is going to work? Should we just be handling this all on our own? And handling it on our own is not feasible either. At $100 a pop for 450 staff on a weekly basis, that would cost us $170,000 a month, which we do not have as a nonprofit organization, and no nursing home has in this country, based on the abysmal reimbursement that we get from Medicaid program. And so the testing is going to be key. We need to have a commitment on who is going to fund this testing, where we're going to get the supplies from on a regular basis, which, for the time being, the Exact Sciences Lab in Madison has been good about getting us the testing supplies that we want, but we need assurance that is going to continue, and that the state is going to continue to pay for that for us. And we also, although our access to testing supplies has improved, turnaround time has not been good, and it's not been helpful. We've been waiting, at a minimum 5 days to get those test results, which is not super helpful. In fact, with the one resident that I mentioned that we had who had a positive case, just with some certain situations with her, had we known even 1 day earlier that she was positive, it would have made a significant difference in some of the higher risk situations that we had occur with that resident, that resulted in us having to have 3 staff members go out on a 14-day quarantine. So we hear in the news that testing capability is improving and whatnot, and that's true in terms of access to supplies. It's not in terms of having adequate turnaround time that is helpful and productive to facilities like ours. So there's that, and then the phased reopening plan for us is largely based on what is happening in the community. It's pretty explicit in saying that nursing home reopening has to lag behind reopening of communities. And so as communities start doing some limited reopening, we can do some limited visitation, but we wouldn't fully reopen until our communities are fully reopened. And as I mentioned earlier, our communities are not fully reopened yet. And so, we need the public to continue to embrace the protocols that are minimizing the transmission at this point. And that number one is masking in public. I know that there are a lot of people who are just done with that and they don't want to deal with it, but it is the single most effective tool that we have in our toolbox right now to prevent surges and spikes that will make their way into the community nursing homes. Our staff have to go to the grocery stores too. And if people, day by day start dropping off with, not doing the masking anymore, it just creates more risk for our staff to pick up this virus and bring it through our doors. I heard on the radio this morning someone say that only 5% of the population has been infected with coronavirus right now, and it's not going to slow down until we have a vaccine or until about 60 to 70% of the population has acquired and recovered from this virus. And when I think about how quickly that could happen in the absence of masking and physical distancing and again, those tools that we know are effective, it's pretty frightening to think about what that could mean for our facilities, and it's frustrating too. I'm not going to lie. It's frustrating that out of one side of some of our elected officials' mouths, they're bashing nursing homes for the number of deaths that have happened here, but out of the other side of their mouths, they're saying we must open the economy, and cases and deaths are just a byproduct of needing to open the precious economy. There is no doubt that we have to balance the economy with protection of life, but there needs to be a recognition that if we are going to make that balance, there are going to be deaths in nursing homes. This virus has simply been called the perfect killing machine of elderly people. And if the community is going to be allowed to kind of go back to life as usual, we don't have all the tools in the toolbox to prevent the virus from being having catastrophic effects in our facilities.
Yeah, absolutely. That all makes a lot of sense for sure. And so lastly, before I let you get back to the rest of your day, I just kind of wanted to ask, this is obviously something that we've never ever seen before and has made changes that we have never had to do before. And so how do you think this will change nursing homes and long-term care facilities in the future? Like, what sorts of lasting effects do you think like the lessons from this will carry out for the foreseeable future?
Yeah, I think we will never go back to not screening people at the door for illness. It's like I said, it's something that we have encouraged in the past. We've encouraged people and posted signs saying, if you're ill, please don't come and make a visit right now. But I think going forward, it's going to be a requirement that we actively prevent people who are ill from coming through our doors. I think that there is a good chance that universal masking is going to continue to be a requirement at a minimum during high peak seasons like influenza season. If there turns out to be a COVID-19 season after we have a vaccination, I think that it's very likely that we will have to continue with source control masking. And I think we're going to have to continue to make sure that our staff do not come to work, even if they have a sniffly nose. Historically, our caregivers, they don't want to call off if they don't have to. If they can push through and show up and serve their residents and be relied on by their coworkers, they're going to come in, despite having a stuffy nose. We need to make sure going forward that people are not coming in if they have any symptoms of illness going forward. It's not going to be a matter of reversing course on that protocol ever. And I think that from a broader perspective, I think this whole pandemic has certainly shed a really needed light on the systemic failures in terms of long-term care funding, reimbursement, and overall support and attention. Nursing homes have been abysmally underfunded by the Medicaid system for decades. And in fact, Wisconsin has been ranked either the worst or the second worst in the nation in terms of Medicaid reimbursement for a number of years. And our workforce challenges, our quality issues can all be tied back to the chronic underfunding of the critical service that we provide and the critical part of the healthcare delivery system that we are. The lack of recognition of the very key piece that we play in the national healthcare delivery system has to be addressed. The complacency that has got us to this point has to be left in the dust. We have long advocated for our own needs, but we are grateful that we have acquired a whole host of advocates for us at this point. And we're grateful that, the narrative that we saw right off the bat is starting to shift. Early on in this pandemic, the headlines were disturbing. Bodies found at nursing home in the garbage area and that sort of thing. That the media was very negative, but we have started to see that narrative shift because we have, those of us who are experts in this field and who can report on our lived experiences have been speaking out and sharing what it has been like on the ground and what kind of support or lack thereof we have received from the agencies and departments and other stakeholders that need to be playing a part in our response. And the narrative is starting to show that there have been failures at every level when it comes to the funding needed for nursing homes and the supplies needed for nursing homes and the testing needed for nursing homes. And ultimately, this is not a political issue. Long-term care and the federal government are inextricably intertwined. We are wholly dependent on the federal government for reimbursement and regulation. And, we are expected by the federal government to have quality assurance and improvement plans in place. Calling out the failures is a matter of quality improvement. Recognizing where we need to improve going forward is what is, truly going to save lives in the future with any sort of second wave of this virus hitting or any new pandemic, any new, novel virus hitting this nation. We need to learn from the failures that we have encountered so far and improve from them.
Yeah, well, thank you so much, Sondra, for sharing those lived experiences with us. And I feel like I end every one of these newsmakers by saying I can't imagine what it would be like to be in your shoes, but it's true. I can't. And all of us out here, thank you for the work that you and your staff are doing, and it's really, really important. So I'm just really glad to be able to have heard your perspective a little bit. So we really appreciate that. And
you're welcome. Thank you.
Yeah. And so thank you to everyone watching for tuning in. I appreciate it as always. And I will be back in 2 weeks. I forgot to look at the date of 2 weeks, but in 2 weeks, I will be back with another Newsmakers. Until then, I hope you all stay safe and healthy and have a great rest of your day.